Do you ever wonder what's going through a person's mind? If I ask you this question, what is physical therapy for you? For sure, the first thing that comes to your mind would be manghihilot or masahista, right? You don't have to deny it, it's always the stereotype that people associate physical therapy with. Masahista, someone who gives massages like the one in the phone, right? Well, we do provide massages like effleurage and such, but we don't limit ourselves to that. There's more to physical therapy than meets the eye. Physical therapists can specialize in different fields, just like the one in this video. So, what do physical therapists really do? First, let's start off with pediatrics. We treat children of different condition, may it be from newborn up until adolescence. Next up, we have sports rehabilitation. We help and treat athletes in maintaining their condition as well as creating a treatment plan that can help them return to function or return to sport after an injury. Next is women's health. We help women in many ways, such as helping them learn exercises that can aid them in their pregnancy. However, it's not only limited to that. We can also treat them postpartum. Next is geriatrics. We also handle people aged 65 and above to help them maintain their health and even provide our services to help them add more life to their years. Next is neuromuscular. We also handle conditions such as cerebral palsy, stroke, Parkinson's disease, and a lot more. May it also be from newborn up to the elderly. Next up, we have musculoskeletal or orthopedics. Amputees, fractures, sprains, low back pain, you name it. We also treat these cases and may it even be teaching them back to the basics, such as walking and many more. We also handle health and wellness, oncology, communicable diseases, cardiovascular, pulmonary, and even now, during the pandemic, we're also helping treat COVID patients. So, what do we do in the clinic? So, usually we are given an hour or two for every session. So, when you come into the clinic, we assess and evaluate your condition. How long does it take? Do we only need one test? Well, we get your vital signs such as your temperature, your blood pressure, your pulse rate, your oxygen saturation, and your respiratory rate. This is to see if there are within normal limits or there are any precautions that we need to take in consideration. Next is we have tests. One of those is range of motion to see if you are able to complete the normal range. Manual muscle testing to see the strength of the muscles. Next is your palpation to see if there are any presence of deviation, tenderness, swelling, edema, and a lot more. Next is for your postural analysis. It is to see any deviation from head to toe. And after this, we perform the gait analysis to see if your body is compensating as you walk or if you have the normal gait pattern. It's not only limited to these tests, as it is different for every type of conditions. There are more tests to do, and one of those would be sensory testing, cranial nerve testing, communication and mental status assessment, and a lot more. We also perform special tests. Now, what is special test? So, for example, in this clipboard, the question is, does the patient have rotator cuff pathology, biceps tendinopathy, or frozen shoulder? So, in order to rule in or rule out if the patient has a specific condition, we perform a couple of tests. Now, these tests needs to be high in specificity and high in sensitivity because it can aid us in diagnosing whether the patient has rotator cuff pathology, biceps tendinopathy, or frozen shoulder. So with the results of the test, we can then proceed into creating the treatment plan. It can consist of strengthening exercises, let's say with the use of a dumbbell, or the patient can be put into traction, or they can perform cardiovascular exercises, or we can apply taping or bandaging. We can also apply electrical stimulation, we can have them do gait training, hydrotherapy. However, the treatment does not limit itself to that. We can always incorporate their functional activities in order to make it more natural and more beneficial to our patients. So now, do you have a gist of what physical therapists do? Well, I already do. I hope you guys have a gist of what physical therapists do. Throughout this journey of physical therapy, there's one thing that I've really realized. Physical therapist surely adds life to years.
I hope you guys have learned something from my video. I didn't go into depth because for sure it's gonna be covered by my other co-interns. So please go and check out their videos. Please don't forget to hit like and subscribe for more. And that is all. Thank you for watching.